Welcome to the Neural Implant Podcast, where we talk with the people behind the current events and breakthroughs in brain implants in an understandable way, helping bring together various fields involved in neuroprosthetics. Here is your host, Ladan Jiracek.
Hello, everyone. Welcome to the Neural Implant Podcast. Today's guest is Andreas Forslund, and he is the founder and CEO, right, of Cognixion, but it's spelled Cognixion. So that's always what I see when I read it. And so this is a wearable kind of VR style headset that's meant to increase communication, and you guys are now turning that into a platform service for others to build off of to help with communication and being able to work with the clinicians in the field. Do you want to explain yourselves? First of all, thanks for coming on. Do you want to explain your product and introduce yourself better than I just did?
Yeah, happy to, Ladan. Thanks for the invite to your podcast. Happy to talk about this. Yeah, so at Cognixion, and you can visit us at cognixion.com. So it's with an X and not a T. So COGNIXION.com. We started out with building an integrated augmented reality headset with EEG sensing for speech augmentation. So imagine individuals that you may know in your life that have had strokes or traumatic brain injuries, any kind of acquired conditions that impact speech and motor, or they might have a neurodegenerative condition that impacts speech and motor. So that was really the core of what we focused on when we started the company. And as a result, we went really deep with certain customer communities. So stroke, MS, Parkinson's, TBI, cerebral palsy, and some others. And as a result of working with hundreds and hundreds of people, individuals that have those disabilities, and working with the clinicians and the heads of, say, neurology at the health systems that they go to, what we realized through this market validation and market feedback was that they loved the platform that we had created, which, by the way, that platform, the Cognixion One device, received FDA breakthrough device designation as the world's first integrated EEG and augmented reality system for communication enablement. So it's first ever. And so that product is still going through the process with the FDA. But what we learned is that, through the engagement and making people aware of that platform, we were really kind of overwhelmed with a lot of scientific researchers and clinical and translational researchers at these health systems that said, gosh, could we use what you created in your hardware, this integrated AR and BCI? Could we use that closed loop system to build other kinds of applications that are not related to communication? And we asked them, well, what did you have in mind? And folks were looking at ophthalmological assessments or diagnostics, looking at concussions or other kinds of lesions that may be emerging in the brain and identifying those locations, looking at therapies regarding attention, looking at just a variety of mental health diagnostics, et cetera, disorders of consciousness, working with locked-in patients and understanding, can we create a quantitative set of biomarkers to know when someone is actually alert, when there's no visible signs that they're actually, attending to anything. And so there's these really fascinating use cases that require deep subject matter expertise to pursue, which we didn't have in-house, and it would be extremely expensive for us to try and build that. So we decided to create a derivative version of our headset, which is available now commercially, called the Axon-R. And we started shipping that in September of last year. And so health systems like Johns Hopkins, Northwell Health, just a variety of Memorial Hermann in Houston and others, these are folks that are starting to build applications on our platform for different clinical use cases beyond the assistive tech side of what we're doing.
Yeah, that's pretty cool. I mean, I think that's a good way to do it. You see a problem and you see that your solution is so good, but you need to focus, and you can only really focus on one thing, but others are clamoring for their product use case, and they want to use that platform. So you basically, I guess, license it out or white label it, or kind of be able to give it to them and have them take the ball and go with their direction. So the platform, what does it look like? How would you describe it? What's the form factor, I guess?
Well, if you haven't seen it already, I would just say Google it. But it looks like a really beautiful. It's like a better looking MediQuest headset. is kind of from the front, but instead of being closed in where you're fully like, the world is sealed out, it's really more of a heads up display. So it's got a large tinted lens in the front that you can see through into the real world, like like glasses. And whoever is interacting with you in the real world can also see your face. And what happens is the graphics are then projected onto the inside of that tinted lens so that the user can see the holograms in front of them as a heads up display, kind of juxtaposed between the person who's wearing it and whatever's in front of them. So, it's similar in functionality to like a Microsoft HoloLens, or you're in Florida, right? So like right there in your hometown, Magic Leap is a well-known augmented reality glasses company. So what we've done is we've taken augmented reality, which is, immersive computer graphic optics, and that you can put over the real world. And we've combined it with biometric sensing. So we can track yaw, pitch, and roll, or cervical motion at a very, very high degree of fidelity. We can track gaze, visual eye gaze, and pupil data regarding sort of what you're gazing at. And we can track EEG data through an array of 6 EEG electrodes on the back strap of the headset. And we have fully integrated all of those sensors into the same pipeline so that you can basically take all the eye data, cervical data, and EEG data and combine those into whatever kind of application you want to build, whether that's an open loop or a closed loop system. There is one distinction that makes the research version, the Axon-R, different than the Cognixion One, which is the Cognixion One was really designed to be the most minimalistic headset from a hardware perspective. So the Cognixion One had fixed EEG positions. The Axon-R has flexible EEG positions with you could place the EEG sensors anywhere you want, basically. And it comes with off-body compute. So the Cognixion One had flexible electronics designed into sort of stealthily into the headset. So it really was all about making it very easy to don and doff the headset. Whereas the Axon-R, which is for research purposes, we're running what we call the nucleus, which is a hip pack. So you imagine you have this AR headset with integrated EEG sensing in the strap, all the computing and displays in the headset. It's fully wireless, has 5G, Wi-Fi, Bluetooth, and all the neuro data is being processed on a hip pack. Now, it has 2 front ends on the hip pack, so analog front ends. And so the second analog front end can also be used for bipolar biometric sensors. So EMG, EKG, any kind of muscular work, or additional EEG sensors. So it's like an expansion cable. So what's really cool about the Axon-R is it's a full neurophysiology system, right? You can take data from your toes all the way to the top of your head, face, eyes, brain, heart, muscles, eyes, neck, and you can pull all that data together and synchronize it in one platform. And then the Axon-R lastly has a software development kit we call BCI Studio, which makes it really easy to rapid prototype immersive apps in AR and start to sort of attach certain data streams from different sensors into the application that you're building. So we've tried to make it really easy and for non-technical people, as well as technical people, to build very simplistic research applications or very complex immersive commercial applications. And so it was really our own internal product that we said, hey, why don't we actually just sell our internal product, because we built it for ourselves to rapid prototype and really explore the fullness from our own research of what's the full neurophysiology. But what we realized is a lot of folks wanted access to the same thing we wanted, but they wanted to build their own apps. So
Yeah, that's pretty exciting. Yeah, it's pretty cool. It looks really good. It's kind of a futuristic looking VR headset, but I guess, as you said, it's a more augmented reality AR, which I think is, and I think VR is a little bit, isolating. So that's really cool. And then, so what kind of use cases have you seen so far? I mean, you mentioned some, I think Feinstein Institute and then clinics as well. Is that something that you're looking at? And so, what would the user, I don't know, walk me through the user use case. Like, how long are they wearing it? Is it just during a hospital visit or doctor visit, or where would they likely use it?
Well, it depends on the application and it depends on the customer. So we have what we call like first and second party applications. So first party applications are apps that we create at Cognition that we're deploying, testing and deploying on our own technology and our own hardware platform. And so those first party applications today that Cognition has created that we're very well known for are in the realm of assistive tech, right? So helping someone that's in a wheelchair communicate, helping someone in a wheelchair or in a bed control their smart home and media controls around them, like lights and sort of the Alexa inside kind of concept. For folks who are in a wheelchair, to the ability to like move the wheelchair with just eyes, head, or brain. Those are use cases. So those are three use cases that are first party applications that we're doing right now. And we're doing that in partnership with the ALS Association, as well as several universities that are doing a lot of the early development on some of these applications. And we're doing a lot of tech transfer into the company so that we'll be the commercial end of some of those apps. Now, as some of the clinical applications you're talking about, like one example is concussion, right? And so concussion's an area where obviously time is essential. And today there really isn't a good quantitative way of assessing someone for a concussion. Usually it's a battery of like it's sort of an interview style inquiry between the neurologist and the patient. Look up, look down, looking for certain kinds of features that affect them that present. And so we're working with actually two systems right now. I can't tell you who, but one's a university and one's a hospital. And they're both working on two different concussion strategies for diagnostics. And the applications that are being built will help quantify the concussion. So one's concussion, and then the other one is blunt trauma. So looking at like identifying location of blunt trauma versus just a general concussion. And so, like a general concussion right now is it's very easy to see that concussion, the magnitude of that concussion through what's called a visually evoked potential. So, as an example, by flashing a particular light frequency in front of a user, we can measure the latency of that light pulse through the optic nerve all the way back to the visual cortex of the head. And we can do that in a closed loop way where we can do multiple repetitive millisecond level measurements of the brain through the visual system as a closed loop system. And you can essentially create a score and a magnitude of the VEP. P is a sort of a evoked potential, which is a spike in your EEG data that corresponds with a frequency, a light frequency. And so usually, simplistically, if you see a very significant spike in EEG related to that frequency that was flashed, it means that you're generally pretty healthy. If you see a muted spike on that particular EEG frequency, then it means that you have a more severe concussion. And so grading that scale up or down gives you a quantitative way that you could assess concussions very, very accurately. And so you think about where that would be useful. That would be really useful at the point of injury, right? So the point here is that the work is being done to validate concussion algorithms using our technology with visually evoked potentials and EEG-based sensing through the visual cortex, and doing that in a closed loop way with a really minimalistic app that could be donned and doffed in the field by a non-technical person, right? So you could say, like, if somebody comes off the playing field and says, I got a bell ringer because I got hit by a lacrosse ball, well, then you can know like whether you need to just ice it or you need to send someone to the ER, right? So, these are kinds of things that are coming and will be disruptive in the world and in the market as a result of cognition technology. That's just one example.
Yeah, that's pretty impressive. So it really runs the gamut from, wearing it all day for somebody with mobility issues to, in the clinic or literally out in the field. And yeah, I guess you're building these platform technologies. So, okay, so this is a wearable technology, and you do have EEGs, which are dry electrodes. So it's not, you don't have to put the gel on or anything like this to apply. You just kind of put on this AR headset as you would any other headset. How does it compare to implantable technologies like a Synchron or Neuralink? Obviously, with the wearable only technology, that the fidelity must be lower, right?
Yeah, I'd say, I mean, depending on who's listening, yeah, I'd say that, there's a big difference between what Cognixion has created and say a Synchron or Neuralink. Insofar as neural, all of the implantable BCIs, we see them as just sensors, right? So you have an implant sensor that gives you a new data source. For us, we're really a computing platform. So we're a computing platform with an application stack that you can build apps based on data from neural sensors. And so we're kind of ambivalent to sensors, whether it's a external sensor like a thermometer or thermostat, or whether it's a ECOG from Precision Neuro, right? And so we're kind of like, okay, cool. It's a sensor. What do you want to do with it? And then then it's like that data coming from the sensor is really just a vehicle. It's a vehicle and a pipeline into our platform. And then the question is, what's the message that comes through that vehicle, right? And the message that comes through that vehicle could be someone's intent, or it could be just a piece of data from a machine. So we're sort of agnostic to the IBCI field, and all of them are going to need some kind of computing platform, whether it's an external computer or a laptop or a tablet or a phone. And all of them are going to need to access apps that people want to use. So I'd sort of say for the more novice members of your audience, thinking about, cognition versus implants, we're really just, we're the front end and the last mile in the system integration that makes a lot of useful applications possible that could take advantage of non-invasive as well as invasive data. Now, if you think about the resolution side, for certain types of applications, invasive is like the only way to go. But for most applications, having grainy, sort of lossy data from a surface electrode is fully acceptable. Because your sample, a lot of, if you talk to some of the implant companies, most of them are not going to be sending raw data to the computer. They'll just burn the battery down, right? Like 1,024 channels of raw brain data, just like assaulting like a fire hose, the computer and the GPU and the CPU. Like, it's just not going to happen. Like, you would need to have a server rack sitting on the back of your wheelchair for that to even be practical. So there's going to be a tremendous amount of filtering and a lot of data that's getting thrown away from the implants. And there's going to be a lot of transformation that has to happen on the implant side before it gets to the computer. So if you think about that in that way, then a lot of the resolution that comes from implants is kind of the hype versus reality. Like, the hype is like, wow, you could do anything with an implant. But the practical sense is that more than likely, the implants are going to be sending keystrokes like X's and Y's, saying like, hit the letter A, hit the letter S, hit the letter D, hit the letter F, right? If you're playing a game, hit the space bar, move the cursor up and to the left. It's going to be very low sample rate stuff that's going to be coming out of the gate from the implant companies in the next 5 years. It's not going to be like, record what I'm imagining, and so in that regard, I'd say where we are with the non-invasive and where implants will be in 5 years, we're about parity, right? As far as like signal quality. And then you say, well, what about speed, right? What about data speed? And, a lot of folks are measuring sort of how well are you on ITR, which is called information transfer. It's kind of like the measurement that they use with modems back in the day. You're a 14.4 baud modem, like when it used to go boop, 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 beep, what's your bit rate regarding your transfer rate of how many bits of data can you send over the line? And so, today, a lot of people get excited, around, how many bits can be transmitted out of the brain to a computer per second. So bits per second becomes a measure. And it's like, that's a really cool measure because if you think about it, the top end of the brain right now, there's a recent study that was published that basically stated that most brain function is capped out at around 10 bits per second. So any kind of speed ratings that people start promoting that exceed 10 bits per second is overkill, and you're overclocking the brain. You don't really need more than 10 bits a second of processing and transmission if the brain itself isn't actually computing any faster than 10 bits a second. So, you sort of look at that and say there's hype versus reality. And so I'd say ITR is a false measure of comparing invasive versus non-invasive. And I'm getting to the point. Here's the point. Like, well, what is the right measure? And I would propose that the right measure, if you're going to evaluate implants versus non-invasive, is what is called degrees of freedom. And so degrees of freedom, DOF or DOF, is a common measurement that's used in bionics, like prosthetic arms, robots, game controllers, immersive stuff. And so very simply, like a 1 DOF, like 1 degree of freedom, is like a binary switch, like a keystroke, on and off, 1 DOF. Your phone, like if you were to use your accelerometer and your phone by itself, and you were to say, like, I can measure yaw, pitch, and roll, or X, Y, and Z, that is 3 degrees of freedom, X, Y, and Z, right? Because you can control it in 3 different directions. That's 3 degrees of freedom. Then you can sort of step up and go higher than that. There's 6 DOF, there's 9 DOF. So like a PlayStation controller where you have like multiple controls, that's like 9 DOF. And so you can do a lot with a 9 DOF controller. And so I kind of share those examples with you because, Synchron, to my knowledge, is a 1 DOF system. So Synchron is a stent. It basically is measuring how hard you can kick your leg or how hard you can swing your arm. And it's trying to break a threshold of a gross motor movement to trigger a keystroke. So imagine that you had to kick your soccer ball every time you wanted to click. That's how Synchron works. Neuralink is more like a magic mouse or a trackpad. So magic mouse is Neuralink is going to be Neuralink and Precision and BlackRock and Paradromics even. They will likely be more like a trackpad in the sense that you can detect intended movement across XY coordinates. So you can do any direction on a flat surface, like up, down, left, and right, and a click. So those are exponentially more robust from a degree of freedom perspective, but that's only 3 degrees of freedom. So you've got Synchron, which is 1 DOF, Neuralink and some of the other high resolution IBCIs are like 3 DOF, and Cognixion is like 9 DOF. So if you were to ask a patient, what do you want to do from a bionics perspective? They want to say, I want to have the most degrees of freedom possible, right? And so I think the goal will really be thinking about the future of what are those use cases that are the highest and best use for implants versus non-invasive, because I would imagine that very quickly, especially over the next 5 years, the pursuit of moving a cursor with an implant, the cost benefit is not going to be there with an implant versus a non-invasive. However, severe therapies and diagnostics and really, intractable things that you can't do at all without an implant, I believe is still going to be there, like the bionics. Like if you need a precision neuroscience or a Neuralink to control like a full bionic arm, BlackRock system to do like bionic arm and an array of those, like that's possible today. So there's people at Johns Hopkins that are using BlackRock systems to control multiple bionic arms and be able to close the loop with sensors that provide neural feedback regarding the sense of touch through those robotic arms. I mean, that is incredible. Like you can't do that with non-invasive. Like that's something you could only do with implants.
Yeah, I think that's something that I don't know, I've also grown to believe is that, there's so much other data that could be coming off, and you guys are using a lot of that is head position, eye position, and a lot of that is really fast. So it's not, the bit rate is, as you were mentioning, is much higher. So, and it's kind of like a data waste, I guess, but it's also very informative, and you can essentially get like a higher, almost like virtual channel count compared to a lot of these other implantable devices. So I think that's the better way to use it and utilize this, I guess, data exhaust, that's kind of just being spit out in the open. And, then meanwhile, neural implants, they're looking, okay, how do we want to get, 50 electrodes worth of, data. And then meanwhile, 50 electrodes worth of data is being, just exhausted through eye
49.
positions. 49, exactly.
Mhm.
So, okay, so you guys are making available this platform technology to others that kind of want to build off of it, that see some use potential. Maybe they add something else, like you were saying, some other sensors, thermometer here, any types of implants or something like this. What kind of savings does this represent, or how much does it help others wanting to develop this kind of technology? For example, how much would it cost without, if they did it on their own, and how much would it cost for, I don't know, FDA approval or research or something like this to go through a system like you guys? What kind of savings might a company or a research group expect?
Oh yeah, I mean, the alternative to integrating with Cognition's Axon-R platform today, whether you're an implant or some other application developer, the alternative is putting together like a mishmash of, do-it-yourself integrations between consumer tech solutions. And so that is fraught with tons of problems. It's like you can never really get out of the lab with that. You can't scale that into like scaling up into clinical trials, where if you had to do a pivotal trial with 200 to 300 patients, where you have high repetition and reliance on high consistency, you just need to have a fully vetted, verifiable ISO 60601 standard platform, right? That meets all the medical grade standards, so that you know that you're building on a reliable system. So the alternative is, go ahead and integrate with Apple Vision Pro, go ahead and integrate with a MediQuest device, but know that you're going to have a lot of problems, right? Your data, you're going to have a lot of waste in the expense. Like the clinical trial process is very expensive. It's very time consuming. And what we found is that some people, like, they've tried to go down that route, and they come back with like a yield of 10 to 15% of the data that they acquired. That is a huge waste. When you're wasting 80 to 85% of your data acquired because it's just crappy technology, like, or you can't even do it because it doesn't meet IRB standards for medical safety and efficacy. I mean, like, it's just a non-starter. So if you want to do anything in the world of healthcare, you'd want to build on the Cognition platform. I'll just sort of say that, full stop. So there's cost savings if you want to go into clinical trials. There's increase in reductions in speed, time to market, because you don't have to worry about those bugaboos. I'd say longer term, the cost to the, I mean, we could talk about costs all day, but by focusing on SAMD applications, SAMD applications are 1/10 the price of doing a medical device. So you could literally invest in 10 SAMD applications. SAMD is SAMD, software as a medical device. So it's like SaaS, or a subscription-based or software-based app deployment that actually delivers a clinically valid outcome. And so if you're going to build a SAMD application, it might cost anywhere from $3 to $10 million to build that and validate it to get it to commercialization. And if you're building a medical device, it might cost anywhere from $25 to $200 million to build a medical device. And that's usually for one indication. So you see, like the cost savings is like, you don't need to invest in bespoke hardware because we've already got the validated hardware. We've already invested over $25 million building the hardware and the platform. So, what would you need to recreate? Well, you need to spend a lot of money and a lot of time, not just building the hardware, but dealing with the people and the network. It's a nightmare. So I would just say, find a way to work with Cognition hardware.
Yeah, no, that's a good case, and I think that's a really good. Yeah, basically 10x, 10x your speed and cost and everything like this. So, how would you prevent other companies? You MediQuest and these big companies, or maybe like a Chinese company or something like this, from building something similar? Maybe if they want to get into this space, what's your guys', I guess, secret sauce? Why would they be hesitant about entering this space?
Yeah, I'd say Chinese companies they can try and do a quick knockoff on the hardware, but they can't build the firmware, they can't build the operating system, the software development kit that we built. They don't have the deep know-how, and they don't have the contracts that we have in the US health systems. So it's kind of a non-starter for a Chinese company to try and do what we're doing and try and bring that to market in North America. They could probably copy it and have Chinese companies doing it in China. That's possible. But entering the North American market, I think, would be a non-starter, and the European market, and probably the Australian market too. As far as other folks, your other question about what's preventing someone.
Like a big
Sorry.
company, let's say Google or Facebook or something like that.
Oh, yeah, yeah. I'd say they've got their hands full on a bunch of other things. Their business models are in other areas primarily. So this kind of thing, even though like Meta has a strong focus on metaverse and sort of immersive computing and AI, Google has just released Android XR. So they have a vested interest in operating system for immersive technology. Samsung partnered with Google on Android XR to build a dev kit for hardware, but still they're all sort of position jockeying for position to try and dominate sort of the standards for and grab as much market as they can for just AR VR hardware. Now that being said, Facebook is still focused on games and fitness. Samsung is still mostly focused on games and fitness. Chinese companies will likely be focused on games and fitness or wellness apps. So they're really, none of them are competing with us in any way for a long time until any of the big companies decide to pivot into healthcare and make like a multi-billion-dollar investment, a multi-year, multi-billion-dollar investment to really get into healthcare. It really kind of requires a really big target for those big companies to say, I'm going to pay attention to that. And so, we've got 5 to 10 years of runway as a company to really build a strong foundation with relationships and making a substantial impact in the field through neurology, where we're just executing right now. So we're just going. And the closest one that would have interest to what we're doing is Apple. Apple has a strong interest in healthcare. They have some really interesting things going on with the Apple Watch, with the AirPods, with the hearing aid replacement now. So we're very familiar with sort of their strategy and how they're going about this process. And they're very similar to us in the sense of they're building really amazing hardware that is really great sensors and a really great application development platform. And third parties are building apps on their watches and on the AirPods, to take advantage of those sensors. So we see ourselves being very similar to them, but we're really doing, if you go into any of their app stores today, all their app stores, the most clinical their app store is like, they don't really have clinical apps. Like you go hunting for some and there really aren't any. There might be some behavioral assessments, but most of any kind of clinical apps that are available on those systems are not generally available in the app stores. So we're actually, you could think about it in the sense that Cognixion is a catalyst for a future app store of clinically validated apps, right? That could be bringing all of that computing to the body, right? So, imagine 5 to 10 years, there could be a neurology-based app store that's full of amazing apps that are brought to you by Cognixion and, name your major health system that has a reputation for doing great neurology.
Yeah, that's pretty impressive. That's really cool. Like, maybe more, medical focused way of, dealing with. Yeah, I mean, I don't see, like a Samsung or Google so much, but yeah, definitely the Apple is the one that's kind of getting into the medical space a little bit more. So, but yeah, interesting. So, do you think that AI will have an issue or have a role in this assistive technology? So we were talking about degrees of freedom. Could almost some degrees of freedom be anticipated by AI? Is that something that you guys are looking into? And yeah, what role does AI play in your guys' company?
Oh my gosh, yeah, I'm glad you brought that up. AI has unlocked so many, or I'd say machine learning is, I need to,
Yep.
my audio just got hijacked, sorry.
Okay.
I just blocked that. AI has we've been working on AI for about 7 years, 7 or 8 years, but we were calling it machine learning before we were calling it AI. So we were thinking about really small, like neural nets. So looking at small neural nets that could run on device on resource constrained systems. because we believe that if you can run machine learning or AI-like applications without a cloud dependency, that's going to be a catalyst for scaling, right? If you have issues where you can't get access to the internet and your application is dependent on that, then you're kind of in a bad spot, right? Because if it's a life supporting kind of application, or if it's something that someone needs to communicate and all of a sudden they can't get to their language model because it's stuck in the cloud, like that's not a good idea, right? So the ability to run critical services and critical machine learning and AI models on device versus secondary or tertiary models that could be tapped into if you have a stable connection to either an edge computer or to the cloud. Like that's how we've architected our system for the past 10 years. And so knowing that the most critical AI applications need to be run on device, meanwhile, you can enrich those AI models or possibly retrain and evolve those models through offline asynchronous compute. And, where like what we've been experimenting with for almost 10 years now is how do you have small local models that are deeply personalized to the user? And then how do we actually go out to a private HIPAA compliant cloud and sort of, train that instance of the model on the net new data, and then let that new model, we called it Thunderdome actually back in the day. So we said 2 models enter, 1 model leaves. And then that new model gets pulled down over the air onto the new device. So this is stuff that we patented like a half a decade ago. But we've been implementing it all the way from the beginning in our architecture. So, but those are just really simplistic things like AI classifiers for biosignal processing. And then you have the more sort of fulsome side of things like LLMs that are going to be running as far as like a speech application, or LLMs for wayfinding and navigating a space in a wheelchair, these kinds of things. And so those kinds of big LLMs do require more compute. And so I'd say the easier way to think about this is sort of sizing your ML or sizing your AI applications to say, we've got large language models, medium language models, small ones, and tiny ones, right? And where those need to live in your overall system architecture, right? That's sort of what we have designed for. And then our customers can decide what kind of applications they want to build. So if you said, I need to access like 100,000 data sets from, 1 million patients with, a billion, a billion variables. And then you're like, well, that's not going to fit onto a microcontroller. Right. So that is going to be how you're going to set up your BCI Studio application so that you're calling to those services. And then you're putting, so like we can facilitate that.
With different expectations of speed too, right? A response rate, like what you're talking about, the billion times a million or whatever, that would be on the order of hours, right? But some things you need, under a second and on chip, on device, something like that.
Yeah, like some things you might need like under 50 milliseconds, and you're like, wow, okay, that's fast. And so we even participated in an accelerator 2 years ago with Verizon, and we went really deep into their 5G infrastructure and looking at 6G and looking at edge compute. And so we have a deep stack of knowledge in understanding latency and cloud services and what's going to interrupt sort of coordinating BCI data with applications, and whether it's done on device, on edge, in the cloud. We understand, which ways to configure it so that you're going to get, 5 to 10 millisecond turn on that data. We know ways that and have relationships where you'd be able to get 10 to 20 milliseconds on those data. So it's like that's the sort of it's hard to do this stuff. Let's just say that it's hard to do this stuff on your own and without partners and without sort of grinding through it.
Yeah, no, definitely. No, that's the reason I think it's important to build off of stand on the shoulders of giants and build off of technology that's existing before you, and that way you don't have to reinvent the wheel to be able to make your stuff happens or clinical trials, and you're able to hopefully get good data and good results and everything like that. So, Andreas, is there anything that we didn't talk about that you wanted to mention?
No, I just wanted to wish you a very happy new year. I mean, this is my first podcast of the 2025 year, and so far it's looking to be a pretty fantastic year. And yeah, I think, if anyone wants to reach out and learn more about the Axon-R product or reach out and talk to someone at the company at Cognixion, feel free to visit our website, cognixion.com. You can also email us if you want at customer care. And we've got folks that can respond very quickly in setting up some, fact finding and whatnot. The good news is we're shipping internationally, and what we also do is we provide a white glove onboarding service so that we don't just sort of ship technology and buyer beware. We want to make you successful, because when you're successful accelerating through clinical trials, we're successful. So our intentions are aligned. And so know that you're going to have a very high quality service regarding post-purchase experience.
Yeah, excellent. Sounds good. Thank you so much.
Hope you enjoyed the show and were able to learn something new, bringing together different fields in novel ways. Until next time on the Neural Implant Podcast.